Right. Good afternoon, everyone. I don't know why I'm so excited about today. I think it's such a great honor to have you, Phyllisa. Hello to everyone who is logging in, who's watching on YouTube, who is on here watching on Zoom, and who will catch up later. Good morning, good afternoon, or good evening, wherever in the world you are. My name is Tonya, and I'm the founder of Diabetes Consults. And the last couple of weeks, we've been sharing stories on diabetes, different types of diabetes, type 1, type 2. And today, we are going to be talking about LADA diabetes. And I'm going to let my guest on here to explain. I've got the beautiful Phyllisa Deroze. Did I get it right? Is it Deroze or Deroze?
Phyllisa Deroze.
Phyllisa Deroze, yeah. I don't have the American accent. I've got the British accent, but we'll get it right. So thank you so much, Phyllisa, for coming on. I'm just going to tell you a little bit about her. She's got a PhD, so she's Dr. Phyllisa Deroze, and she's an independent scholar in literature, human humanities, health humanities, and the Black feminism. And after graduating from Pennsylvania State University with a doctorate in English literature, she worked as a professor in the USA and in the United Arab Emirates for 10 years. In 2013, she received a Fulbright to the United Arab Emirates, where she studied the connections between the Arab feminism and womanism. Wow. In 2021, she became the director of research for a diabetes research company, and she spends her days helping improve the lives of people with diabetes. Additionally, she's a diabetes lifestyle blogger and a global patient advocate, hence she's on here. She enjoys creative and academic writing. Her recent publications include the Daily News Blues, a flash fiction story highlighting the intersectionality of COVID-19, mental health, and disability. So woman packed. She also has written a publication on Laughing to Keep from Dying, Black Americans with Diabetes in Sitcoms and Comedies, an academic book chapter about the representation of Black Americans in TV and film. And she's working on a memoir about Black maternity health. You can always contact her by email. I'll share her details on here. She's a power-packed woman. And I'm so blessed to have come across you on Instagram. Thank God for social media. So Phyllisa, is there anything that I have missed out on your bio? Do you want to tell us a little bit more? Is there anything else that's missed off?
I guess I would be remiss to say that I have a French husband. So my name Deroze is actually French, and I have a little princess who is also a swimmer. We won a championship 2 weeks ago. So my 6-year-old is into swimming, and I'm excited about that. But, you know, I'm just a human girl trying to make a difference in the world.
Awesome. And you're doing a marvelous job. I see all the things that you do on Instagram. And, you know, I'm just in awe of you. I keep telling you that. And I'm not just saying that because you're on here. I'm always watching for you on Instagram. Like, what's she up to? What's she, telling us about? And I like the fact that you're on the global markets and obviously enlightening people globally. It's not just America or the United Kingdom. It's obviously it's a disease that affects people globally. So can you just tell us a bit about yourself? Like, when were you diagnosed? How did the story of diabetes just start with you?
So I have to say that in January 2011, felt that I was on top of the world. You know, you just have those moments in time where like everything is going right. That was me, January 2011. I felt that everything was going right. I had finally completed my PhD, which we know it takes a long time to, do that. And I was a professor. I was not only a professor, but I was at in HBCU, which is the historically Black colleges and universities here in America. So I I just thought I had finally reached like nirvana. And towards the end of January that year, I started feeling really tired. And I would say it to a colleague, and they would say, "Oh, it's that time of year. Everybody's tired. It's January. The weather's cold. Like, the here we have the time change, so it's typically darker in the wintertime." And by Valentine's Day, which was February 14th, I had passed out in my bathtub, unconscious for an unknown amount of time. Prior to that, I had gone to a doctor and said, "I'm really thirsty. I'm frequently urinating. My vision's a little blurred. I have tingling in my hands and feet." Like, I had all the classic symptoms that would let a physician know, check her blood sugar. But my blood sugar was never checked. And I was told to drink sports drinks because I was working out 5 days a week. And it was like, "Oh, your electrolytes are off, so drink sports drinks," which of course are full of sugar, which is probably why I passed out in my bathtub. Anyway, that completely freaked me out. I had never lost consciousness before. So the next day, I went back to the doctor and said, "You told me last week to drink, sports drinks because of my electrolytes and stuff, but that's not it. Like, something's wrong." I knew I was dying, Tony. Like, I literally left my house with a bag and I said, "I am not returning home until someone tells me what's wrong with me." Like, I packed an overnight bag. I was like, "I am not coming back into this house." I was living alone at the time. Until I know what's killing me. I ended up leaving the doctor's office, and a colleague took me to the hospital where I spent 6 days. So I'm very glad I had that overnight bag. And it was at the hospital that they told me that I had diabetes. My blood sugar at that time was about 597, 593, something like that. I was losing consciousness. I was unable to walk. I was in a wheelchair in the emergency room. Literally I had just a few hours left before I was going to close my eyes for the last time. I was terrified, frightened, scared. No one in my family has diabetes. I didn't know anybody who had diabetes. And I honestly didn't even know what it meant, right? I thought, okay, I have diabetes, but then I'm going to get a cure. They're going to figure it out and I'm going to leave well. So it took some time to understand that I'm forever changed for the rest of my life. And I was 31 at the time, newly married, hadn't celebrated my second wedding anniversary. So I didn't know what that meant for children as well. Heck, I didn't even know what that meant for my marriage, right? Would we get through this? How would that impact us? So I could just say, for my diagnosis, that's how I was introduced to diabetes. And I spent 6 days in the hospital really contemplating a lot, my life, trying to figure out how this happened.
Yeah. Wow. I didn't know this bit about you. I know we talked a little bit, but not this much. So how did you deal with, I know you said you were in the hospital, you were newly married. How did you deal with the whole, because how it operates in America is obviously different to, I'm in the United Kingdom, how we obviously diagnose and we have so much information sometimes that we give patients, and sometimes they get missed off. But how do you, because obviously the information, we pour so much information at you, but how did you deal with the diagnosis? The fact that, you were living alone, newly married, having your life on top of the world, and all of a sudden just you got given this diabetes diagnosis.
I struggled. I started actually writing my blog from my hospital bed that week because I have close friends. I have a nice close circle. And so I called one and said, I'm in the hospital. And the severity of diabetes also was something that I didn't quite understand. Like your blood sugar being 593, like I don't know what that means, at this time. I just know my vision is not what it was. And I wear glasses, right? So like my vision is blurred. I can't see. I've passed out. I've lost consciousness. My feet are tingling. I'm passing out. I'm also, I didn't say this, when I was given a lecture in my class, I would try to say things and then something else would come out. So for example, when I teach African American literature, 1865 is an important date, year, because that's the year that slavery was officially ended in the United States. Well, the Emancipation Proclamation was signed, let's say that. And in the lecture, I would say, the Emancipation Proclamation was signed in 1992. Like that's what came out. And then I'm like, it wasn't 1992. Like, where did that come from? So I understood that I had cognitive issues. And I'm trying to process all of this. Like, what does it mean? I just knew I was dying. So I told a friend, and then they were hysterical, and I could not deal with their taking of it. So I ended up writing my first blog post, emailing it to my friends and telling them, when you read this, then you reach out to me. So I told them what happened. I also want to say at this point, I was 5 years into a healthy journey. My first trip to Paris, I struggled with weight and I didn't want that struggle anymore. And so I had lost like 50 pounds. Sorry, I don't know how many stones that is or kilos.
Yes, divided by 2.2. So that's about 25 kilograms.
Okay.
Yeah, roughly. Yeah.
Oh, so yeah, so I had lost a lot of weight. I was feeling good. I was eating healthy. And that was probably what I heard most from my friends. My friends were like, but wait a minute, how did you get diabetes? You exercise all the time and you eat tofu and kale and whatever else, this kind of thing. So some of the traditional stereotypes about who gets diabetes also I felt confronted with and conflicted with. Things like healthy lifestyle. Well, I had a healthy lifestyle. Things like genetic factors. Well, no one in my immediate family has diabetes. So things were very confusing. The information I had received, I got 2 pamphlets, one for type 1, one for type 2. They had no idea what type I had. They told me to read them. The pamphlets, I have to say, were not very helpful. Because the one for type 1, there were all these children. I'm 31 years old. I'm a professor. I am married. Like, what do you mean a 10-year-old? So I'm like, I don't really identify with the 10-year-old, and the pictures were predominantly white children, of course. And then the other pamphlet were senior citizens. And I'm like, but wait a minute, I'm only 31 years old. So I honestly didn't identify with any of the visuals in any of the pamphlets. And then neither one of them did a really good job of addressing where I was emotionally. They did a lot of statistical presentations. In America, they're really big on identifying and slicing data by race. So some of the pamphlets were like, oh, if you are African American, you're 4 times more likely to have a heart attack, stroke, amputation, blindness, and death from diabetes. Like, I don't want to read that. And, so needless to say, I put those pamphlets down. And the nurse came in and was like, have you read them? I said, oh, have you read them? Was my response. Like, how can you tell me I have diabetes and then give me these pamphlets and expect them to like even penetrate my mind and my emotions and my spirit and where I am. And I will say this, my husband was in Paris, couldn't come see me. my mother and my parents were in Florida and I was in South Carolina at the time, they couldn't come see me. So I was literally in the hospital 6 days by myself. I didn't have anyone who loves me come walk through that door. And that was also hard.
Wow. So this is again, like I said, I didn't realize all of this. And it's obviously good to share because somebody out there is probably going through the same thing or something similar. So from your story, you said that there wasn't any information of whether you were type 1 or type 2. So I'm guessing they probably thought you were somewhere bang in the middle, which then leads me to, how did you end up finding that you had LADA? And obviously for our audience, in your words, because I'm a clinician, can you explain to them what LADA is?
Okay. So I get to the correct diagnosis of LADA many years later. When I was discharged from the hospital, I want to say this, I was discharged with the glucometer, but no strips. I was discharged with insulin pens without any needles. So when I got home the first night, I had no idea how to manage diabetes. I was given a bag that was incomplete. And I ended up leaving home, scouring the city, trying to find strips. And that's when I found out test strips cost $89 for 50, and I couldn't afford it. My husband had to wire me money from Europe so that I could afford $89 for 50 test strips. And then I had to buy pens to go on top of my insulin. I had to take my basal insulin and my bolus. So I have to say I left the hospital very ill-equipped to manage diabetes. 10 days later, I had to see an endocrinologist, and it was there that the endocrinologist told me that I had type 2 diabetes. So I lived with the diagnosis of type 2 diabetes for 8 years. Wow. Just 2 years ago, I was correctly diagnosed with LADA, which is latent autoimmune diabetes in adults. And how that story came about is, one, I've always been the kind of person that wanted to know where my blood sugar was. And that set me aside from a lot of people that I met with type 2. And I still don't really know how I feel about that, but I have to say that that's what saved me. Because a lot of people with type 2 do not check their blood sugar often. And I have to say part of that comes from clinicians and what they tell people. Like, I have been told by every single endocrinologist that I have had in the United States and also in the UAE that I check my blood sugar too much. So I would pay for extra strips so that I could test at least 3 times a day. Because I had that data on myself, I could see that when I would go to the gym, cardio was no longer impacting my blood sugar levels. Like, they were not dropping as significantly as they had before. Because I would check my blood sugar before I started at the gym because I needed to be in a certain range to work out. And then I would check 30 minutes after my workout ended just to see where I was. That was like, nothing came in between that. Like, I needed to know that information. And so that was probably the first thing I noticed, is that my cardio was not dropping my blood sugar as much as it did. So I inquired about LADA after learning another type 2 diabetes advocate had been misdiagnosed for 7 years. And I thought, how could a person and I'll tell my story. But I was thinking, how could someone be misdiagnosed with type 2 diabetes for 7 years? Like, what is that like? And so I reached out to him and he said, get tested for GAD65 antibodies. So here I am. I asked my endo, I said, can I be tested for the GAD65 antibodies? And I was told, no, there's no need for that. And I just, it's my doctor, right? I let it go. But then I did a presentation in Dubai to a room of physicians from the MENA region, MENA, Middle East, and North Africa. And I shared my story, just like I'm sharing with you, Tone. Like I'm telling people how I was diagnosed. And some physicians from like Tunisia, Morocco area, they said to me, it sounds like you have LADA or type 1.5 diabetes and not type 2. Just listening to my story, they say this, right? They are not my physicians. They have seen none of my A1C results or any medical records. At lunch, one of the physicians, she comes up to me and she says, you really should get tested and don't stop until you get the answer. And that don't stop until you get the answer was kind of haunting. But I saw my endo the next week and I said to her, I'd like to be tested for type 1 antibodies like the GAD65. This is now like 8 months later from my first ask. So she says no. But because this woman told me, don't stop until you get the answer, when I see her again, the next 3 months, I ask, well, have I ever been tested for type 1 antibodies? She looks, she says, no, you've never been tested. And then I'm like, bingo, can I get tested, right? No, you can't get tested. I see her again the next 3 months. Now at this point, I'm like, I need a second opinion. I see a second opinion. And when I see a second opinion, this gentleman is offended by me asking, because of course he's gone to medical school and he knows by scrolling and looking at my A1Cs that, I have type 2 diabetes. Meanwhile, Tanya, what I'm seeing in my A1C is a gradual increase.
Yeah.
And that's a problem for me because I'm now doing 5K races every few months. I've done 40. I'm going to do one this week as well. So it'll be my 41st 5K. So I'm exercising all the time. I've restricted a lot of carbs for my diet. Like for me, I can't do anything else. But I see my A1Cs like every 3 months, they're increasing. So I don't know what they were looking at, but I was definitely like, this is a problem. When I work out, my blood sugar is not going down. My A1Cs are increasing. And for them, they're just giving me more medication, take another pill, do this and that. And I was like, we're at a problem here. So how I ended up getting the diagnosis is after the second opinion denied me, I went on vacation to America from the UAE and got sick. Horribly sick. Because I had been in DKA, diabetes ketoacidosis, the first time I knew what it was. And I knew I was in diabetes ketoacidosis. At this point, I'm wearing a CGM so I could see my blood sugar is staying at 300, 350. Like nothing is bringing it down. Of course, I don't have insulin because you don't need insulin is what I was told by my physicians. Orals are okay. They were not helping me. And I ended up going back to Abu Dhabi to seek care because care in America is astronomically expensive if you don't have an insurance plan. So I was like, family, we have to go back home. And I asked my gynecologist if she would run type 1 antibody testing for me. She did. She got those results 10 days later and they came back through the roof. And she told me take those results to my endo, which I did. And that is when my endo said, stop taking all the oral medications I've given you. You need insulin immediately, like come in the office today because you have latent autoimmune diabetes in adults.
Wow. it's such, it's, I don't want to use the word nice to say, to hear someone say this, you know, and as a clinician, this year alone, I've had 4 patients that I've had the suspicion that they are LADA diabetes. Now, we manage it differently here in England. And some of the features is some of them have, not everybody has that very slim, sleek nature. But then some of the features that make you wonder is when they're maximum therapy and their blood sugars are still spiking, no matter what you've done, everything possible, and there is nothing. And even if they're eating out of the range, but the way their blood sugars are high, I always say to them, I'm just going to send you to the hospital because we can't do it in primary care. And I have to send them to the hospital. And I would write the reason why I'm sending them to the hospital. It costs a lot of money to do those antibody testing. And I can see why some clinicians are saying, no, you don't. And for the audience who are watching and will watch later, a lot of the times with type 2 diabetes, I would say, like they said to you, don't stop asking. If you do have type 2 diabetes and your blood sugars are very, very raised and you're on, you know, like treatment therapy, you know, you're doing everything that you can do, but irrespective, they're still quite high. You need to actually insist and persist, you know, that they definitely do some antibody testing on you, just so that we can actually rule out. There's no harm in doing it. But in the interim, if you're getting the thirst and the tiredness like you did, I always say to patients, I'm going to take you off the medication or add insulin to that medication, just so that we can just bring your blood sugars down. And if you're not a GAD, you know, like you don't have positive GAD antibodies and C-peptide, then obviously we would start to rule you off, because a lot of people also fear the insulin. They keep going, no, I don't want insulin. I'm going to put on weight and I'm going to do so many things. So thank you for sharing your story, because a lot of people have asked me this question, seeing the flyer saying, there is anything else more than type 1 and type 2? And I'm like, yes, there is at least 6 other types of diabetes, but obviously the focus is always on type 1 and type 2. And like Phyllisa said, a lot of the times people are diagnosed with type 2 diabetes and they get missed off. So normally after 18 to 2 years, if at least if your blood sugars are that high, please disturb your endocrinologist if you're in America. In England, disturb your GP, come to us, you know, come to whatever clinical, we have nurses, pharmacists like myself, who actually look after people with diabetes. Let us actually request that, you know, look at your trend, and then obviously request that for you. Now, obviously you're on insulin. How did you get to grips? I've talked about, you know, like a lot of my patients or people living with diabetes, you mentioned, especially of the African, you know, like community, you say to them insulin, and oh my God, some of them will say to me, I would rather die. But then when death faces them, they say, I don't want to die. How did you deal with actually having to inject yourself and knowing what to do, knowing fully well that you've been on tablets for all these years? How did you deal with that switch in terms of obviously going onto insulin?
For that, I want to go back to my first diagnosis. So I live with two diagnoses. The first one, when I shared with you that I was in the hospital with a blood sugar of 597, I clearly needed insulin. Like there were no other options. So my introduction into diabetes happened with me viewing insulin as a lifesaver. And that is different from people who, you know, are on a routine visit, their blood sugars are a little elevated, so the doctor gives them an oral medication and, you know, things like that. So for me, insulin is what brought my vision back. It stopped the tingling in my hands and feet. It brought my consciousness back. Like insulin saved my life. So my view of insulin has been shaped by that. Of course, at some point, I was weaned off of insulin. I lived nearly 3 years with just diet and exercise only. I did not take any oral medications. My blood sugar was perfectly fine, 5.5, 5.4. I stayed in that range. And then I was on orals, injectables. And I have to say this, Tony, a lot of people say things like, how can you inject yourself? But some of those same people don't want to take the oral medications either, right? I was one of those people that I felt like I know what's in insulin in the sense that it is a hormone that our body makes. Insulin is in your body, and within 4 or 5 hours, it's gone. But now these oral medications, the side effects of like, they go on and on and on, and then they're in your body for hours. Like, so I would rather inject myself with something that, you know, is like a hormone our body naturally makes, and it's out of my body in like 5 hours, than to take a lot of oral pills. So my journey was always like, hold up, another pill, because that's what was happening as my blood sugar was rising. Take another pill, take another pill. And I ended up sitting down with my endo at some point, and by the time we got to the third pill, I said, I'd rather take insulin. Like, you know, I mean, we're on the third pill now, you've increased the dosages. And so she asked why, and I told her that. I was like, I don't know what all these pills are doing to me. You know, one is like making me urinate the sugar out, so it's impacting my kidneys. The other one is like making my pancreas give more insulin. I was just like, I'd rather insulin. And so I share that to say, the first time I had to give myself an injection was in the hospital during my first diagnosis. And it was Nurse Pat. I wouldn't try to tell this story without crying because I'm always like, oh my God. But there was a Nurse Pat. And so she came into the room, and I just was like, oh my gosh, it's time for my insulin injection. And so I said to her, you're here to give me an insulin injection? And she said, no. And I was like, because I knew, you know, they give me insulin injections on this time. And so I said, well, it's the time for the insulin injection. And she said, yes. I said, and I see the cart, you know, you have the insulin and the vials and all of that there. And she said, yes. And I said, but you're not here to give me an insulin injection? And she said, no. And she got closer to me as I was on my bed, and she said, I'm here to teach you how to give yourself an insulin injection. Shanae, I was done. I was done. Oh my gosh, I was bawling, crying, because all the other nurses, they had just given me insulin injections and had left. And this woman's telling me, I'm gonna have to do this for like possibly the rest of my life. And she was so nice. Like, she held me. Like, she held me mentally, spiritually, emotionally. Like, she let me just cry and bawl. And she said, I have to do this because there aren't going to be nurses in your house. Like, it's just going to be you. And you have to know how to do this. And I just will never, ever, ever forget that moment and forget what she did for me. Because I also wonder, what if Nurse Pat wasn't there that day? Because no other nurse did that. No other nurse taught me how to give myself an insulin injection. And so because that's my introduction, like, insulin saved my life, I don't have that same reservation and hesitation. And also just because of how I am about medication that has 15 side effects, I don't know. When people say that, I ask them those questions, like, would you rather give yourself an injection or ingest oral medications that have a lot of side effects? So I'm always curious about the knowledge base of of medications and how much people know about them and what part of the body it impacts. So these are questions I always ask, especially when it comes to diabetes medication for people with type 2 diabetes, because some things affect your kidney, some things affect your liver, some things affect your pancreas. Like, you need to know what part of your body this particular oral medication is impacting.
Yeah, it's so true. Well, here I can see obviously the difference between how things run, possibly in America, and here in the United Kingdom. We have searches here where, in our computer system, we have to check if a patient's on this medication, what is their kidney function? How low does the kidney function have to go? Do they remain on this kidney function? If so, if their kidney function has dropped below a certain level, we then need to stop certain medications. But we have all the searches implanted, and I think that's one of the benefits of the national health, scheme that we've got here, which not every country is obviously adverse to actually having. And it's actually good to know. I'm just going to retract a little bit before I ask the next question, because like we've talked about LADA being latent autoimmune disease of adulthood in adults, which is the LADA. And I just want to say, like, it's actually a slow progressing form of an autoimmune disease, which we haven't clarified is actually autoimmune. Because some people say, oh my God, the drama I get in clinic, people go, what have I done? It's my fault. I've done everything wrong. I should have not eaten that ice cream 3 weeks ago. I knew I'm coming to see you. There is nothing you could do. We talked about this 3 weeks ago when we had a lady with type 1 diabetes, LADA diabetes, and that's why it's called a type 1.5, because it has similarities to type 1 and type 2. The difference is that it's a slow progressing autoimmune disease. So it actually, most people will think they've got type 2 and they're left in that type 2 region for a long time. Now, where the switch is between type 2 and LADA is that the autoimmune disease kicks in, where your antibodies are fighting your body, and therefore your pancreas is not able to produce the insulin that it should do, and you end up depending on insulin. I just wanted to add that in because I think we hadn't really got into it. Now, my next question to you then goes on to our diets, African American diets, African diets, Caribbean diets. We love our food. We have so much variety in our food. How do you manage your insulin and your diet, your African American diet? Because I don't know if you got rice and peas or plantain and all the things that we tend to enjoy, like the Mexicans have, the Americans have, African Americans have. How do you manage your diabetes, your insulin levels with the food, that you enjoy? Does that mean that you don't eat what you enjoy anymore and you just eat cucumbers and carrots, or are you still enjoying yourself and still living life?
I have to say, when I was first diagnosed, I had the same question, like, what does this mean in terms of my diet? Because people told me I needed to have dietary changes. And I didn't want to not be Black American with diabetes, right? Like, I didn't want diabetes to make me have some standardized non-Black Southern diet, because culturally, when you look at what culture means, culture is food, culture is our beliefs, culture is our speech pattern, culture is the way in which we laugh. I don't care where in the world I am, and I've been to 22 countries now and lived in 3. I know when Black people are laughing. Like, I could see the shadows off in the distance. We laugh with our entire body, right? Like, I don't care where I am in the distance. I could be in Bangkok and I'm like, that's a group of Black people laughing right there. So culturally, I just didn't want diabetes to take those things away from me. And I love grits. I'm from Florida. My family's from South Carolina, so the deep South in the United States. And we eat this a grain in the morning, grits. And And I asked this woman, I was in the doctor's office, newly diagnosed, seeing my endo probably for the first or second time. And I said, excuse me, do you still eat grits? Like, she just looked like auntie, you know, somewhere you're just like, auntie, you still eat grits? And she said, oh, yes, honey, I still eat my grits. And I was like, how? Right? Like, so this was so important for me. And she just talks about understanding carb counting and making sure that if you want grits, you can still eat grits. You just probably can't eat a pot of grits. You can't eat a big serving of them. And one thing that I notice about our diet, whether that is Black American, Caribbean, West African, East African, we have vegetables in our diet. And I feel like a lot of our conversations don't highlight that and focus on that. And so part of what I have done is thinking about our foods and the vegetables that we have and then centering it around them. So when we do have our leafy greens, what's the things outside of it? And it's a transition, right? Because when you think about rice and peas and you think about jollof rice and you think about these things, it's the starch. But now in my jollof rice, when I make it, I add more vegetables. Now when I want my Jamaican peas and rice and my callaloo, I have more callaloo. When I'm in the mood for a beef patty, I go for the saltfish and callaloo patty or the vegetable patty, because really you just want that patty taste, you know what I mean? The flakiness of it. And so these are the options that I have. So I do not take these things off my plate. I just limit how I eat them. I no longer eat pieces of cocoa bread, even though it's so not when it's out the oven and it's buttery. Like, how could you not eat all the cocoa bread in the house? So I don't deny myself of these things. I'm just now more conscious of eating my vegetables every single day, eating my vegetables often as the first thing, then saving my plantains for second, my rice and peas for second, my macaroni and cheese for second, my cornbread for second, potato salad, like these things. Also, a lot of our proteins, fish, many places are really big on fish. When it comes to stew, I have a little less gravy, because sometimes a lot of the stews are thick. I make them more thin with tomato base and little modifications is what I would say I do. But I do my best to make sure that I'm still able to enjoy the holidays with my family, that I'm still able to enjoy the food. And oftentimes what that means is I bring the greens to, like right now in America, we're preparing for Thanksgiving. And I know when I go to my family's house to bring the green vegetables. I was up this morning making cabbage because during the holidays, people tend to focus on the other foods. But I have to have the green vegetables. I have to have those things. So those are the little dietary changes that I make. So I don't take anything off my plate. I just reduce the amount of so many carbs at one time.
Wow. Right. There is a lot to ask, and I'm obviously conscious of time, your time, and the time of everyone in here. Thank you so much. This has been so obviously educational, and I'm hoping that people are finding it useful and will find it useful. Now, I understand that obviously America works in a different way to how we work in the UK. But when you find the right endocrinologist like you do, here we have nurses, we have pharmacists, and then the very, very complex cases get taken to the consultants. How is it important when you find the right clinician? Because in America, you can chop and change who you see. We don't have that choice per se. You're within a vicinity, unless you want to go private and pay for your services. How is it important when you find a really good clinician or an endocrinologist in your in your situation, is it to have a relationship with them in terms of managing diabetes?
It's extremely important. And what I often tell people is that when you get your results back, like your A1C test results, that is an indication of your past. You have to be able to have a conversation with your healthcare provider, whomever they are, whomever is over your care, and tell them about your future. And I say that because when I had my daughter, I had a very difficult time. I ended up having a complicated birth experience that caused birth trauma, which then led into, postpartum depression while I was also dealing with that. So when I got my A1C, it was great. And my endo said, "Oh, it's great. Like, keep doing what you're doing." And I was like, that's my past. Right now, where I am emotionally, I'm about to go on vacation and I'm not going to be concerned about diabetes. I need to be more concerned about my body and healing from my birth experience. So emotionally and mentally, I'm not in a space to prioritize diabetes like I had been prior to giving birth. And that was important because my doctor at the time was able to equip me with the tools that I needed so that in case I go on vacation and my blood sugar rose, I had insulin to bring it down, or, another medication or whatever the case may be. My point is, I needed to have that relationship so that we could talk about where I am as a person to then get the tools that I need to manage my diabetes better, even through the midst of what I was dealing with mentally.
Thank you for that. You just led me to a question that I haven't thought about, and only just thought about as you were talking, and which is something that a lot of it is actually sidelined a lot. How do you deal with the mental? Like dealing with diabetes is a lot. Like my mother would always say to me when she was alive, bless her soul, she would say, "You don't have diabetes, I have diabetes," and it's a lot because at the time I didn't know any better. I wasn't a clinician at the time. And I would say, "Don't eat that, don't eat that, don't eat that. You shouldn't eat that, you've got diabetes," because that's what I knew. And I thought that I was being helpful to her and I wanted to keep her living for long because she was my mother. But I didn't really take into grips the emotional aspect of the diabetes and how she dealt with it. She was always a lady that was on the bigger side, and everyone kept telling her, lose weight, lose weight. And she was doing everything she could. Now, how do you deal with the mental aspects of diabetes? Because it encompasses quite a lot, but can you share your tips, a little bit of your tips on how you manage that by yourself?
One, I want to just say, one, God bless your mother. And two, that diabetes is a lot, and a lot of people managing it don't really have the opportunity to talk about it. So thank you for giving me this space to talk about it. One, I want to say how I manage diabetes now is I have an insulin pump, and I'll share with you because I'm matching. I was like purple. So for me, carrying around the insulin pens and needles, that was stressing me out. Like it was just a stressor. And I say that because as a Black American woman now living in America, I don't know what can be perceived as a threat. I don't know how, you're walking around with a needle. Someone may think you're a drug addict. I don't know. It was stressing me out to have that. So I'm saying part of my mental stress was also the tools that I was given to manage diabetes. I had less stress about managing diabetes because I now have a cool looking insulin pump to help give me insulin. So how you manage diabetes impacts your mental space. Living with the condition, like I just shared with you all about eating with family for the holidays. It's Sunday, Thanksgiving is Thursday. I'm already thinking about the stress of what people are gonna not bring to the dinner, or what they are gonna bring, or who's gonna say something about whatever I'm eating. And also, as caregivers of loved ones who have diabetes, when you see someone eating something that you think they should not eat, the first thing you should say is, how's your blood sugar levels? Because if their blood sugar is low, they should be drinking the juice. They should be eating the cake or whatever. I know we shouldn't necessarily eat cake because it, the fat in it does not raise your blood sugar high, blah, blah, blah. But the reality is sometimes you only have cake. Sometimes you only have pie and whatever. So whenever I find people asking me, should you be eating that ice cream? I'm thinking, my blood sugar is going down. And this is what I have right now to bring it up. So I would just say, start with that. Like, how's your blood sugar? Like, can I help you? Like, are you experiencing a low? And then the last thing I'll say is, sometimes I'm in a rut emotionally. I'm dealing with everything everybody else is dealing with. COVID has been a rough time. I feel like we're just in global mourning. Like, everybody knows someone who's impacted by COVID-19. People are dying, like, especially the diabetes community. We're significantly impacted. Sometimes the healthiest thing I can do is eat the cake. Like, at the end of the day, if I'm having a stressful day, if I'm dealing with something, like, sometimes you don't know. Like, literally, I did not drink coffee until I became a mother. And I tell people, sometimes drinking this cup of coffee is the healthiest thing that I can do, because the other alternative is not necessarily a positive one. So again, if you see your loved ones kind of falling off the track or the wagon, tap into them. Ask them how they are doing emotionally. I don't have people ask me how I'm doing emotionally. I have people ask me, how are your numbers? What was your last A1C? These things. But people aren't asking me, Phyllisa, how are you dealing with the burden of always having to calculate how many units of insulin you need to take before you put anything in your mouth? Before I put anything in my mouth, before I drink my coffee, before I eat an egg, before I have dinner, before I have breakfast, like, every single day, day in and day out, that's what I have to do. People don't ask that. And it's a lot to carry.
Yeah. I think that's, like I said, that's one thing that everyone, including us clinicians, we forget, because you're so time conscious and you're thinking, I've got to fix your A1C or HbA1c, I've got to fix your glucose levels. And if you're going into chronic kidney disease, I need to do this, and this. And I, as a clinician, I've formed a habit of, that's the first question I ask, how are you? And I have a lot of patients take it back, like, is it and I'm, no, how are you? And sometimes I have to get a tissue because people just bawl their eyes out and go, oh my God. And I'm thinking, okay, we're not going to focus on the HbA1c today. We're just going to find out how you are. And then I hear my daughter is getting divorced, or my son is getting this. And sometimes it's a therapy room. I'm thinking, I'm not a therapist, but you get to be everything for this, patient in front of you. So thank you for sharing, because I've just made a note on here to just write to myself, to remind myself to ask people how they're looking after, like how they're dealing with the burden of diabetes, because the emotion, if you're not in the right emotional state, whatever we say, it's just not going to help anything. Now I have two more questions, because you kind of answered the other, question. Now, a lot of people say I'm worried about this. What are you most worried about in terms of diabetes? Is there anything that, living with LADA now, what worries you the most?
I am most worried about diabetes complications, knowing that I could do everything right and still end up with complications from managing diabetes. That, I would say, is the thing that I'm most concerned about.
Yeah. Now, I don't know how it works in the States. Here in the United Kingdom, and I can see some people obviously logging in from Nigeria, somebody from Gambia. So we've got people, and I don't know what the views are on YouTube. We have people all over the world. But here in the United Kingdom, I always say to the patients here, you're very fortunate in some sense, because we have once a year, you get to go for an eye test where they check the back of your eyes to make sure you don't have retinopathy. We do twice a year, at least a minimum of twice a year. We do blood tests to make sure that your kidney function is not going, you're not going into what we call chronic kidney disease. If you do, we need to help to manage it. We check your blood pressure. We send you to have once a year your foot checks to check your nerve endings. For the men, we get to talk to them about erectile dysfunction. How is the bedroom life? Is that similar to America, or is that completely different? Or do you have to manage all of that by yourself, or would your endocrinologist actually call you in to actually discuss all of that?
It's slightly different in the US in the sense that they have recommended, they being the endocrinologist, have recommendations to see those other doctors. So we have to call and make those appointments. And I do want to say that a lot of people in the US do not see endocrinologists. It's just my own personal preference that I see a specialist for my diabetes. And we pay more to see specialists as well. So the way the insurance works, if you see a primary care physician, you have a very low copay that you pay. Some people, it's like $20. To see a specialist, whether it's a podiatrist, cardiologist, endocrinologist, you could pay $75 or $150 just to see that specialist. Because I see my endo only every 3 months, I just budget that in. But all the other doctors, I have to call and make appointments to see them. So I have to make an appointment to see my cardiologist, the ophthalmologist to get the eye exam, things like that.
Okay, thank you for that. The reason why I asked that was if anyone is not in the United Kingdom, I'm going to address those in the UK, and you have to pay. I think, yes, there is money, and I don't know how people deal with money and their money, but I think these are things that should be prioritized, because if you don't get your vision checked, we would not know if you're going into retinopathy, and we wouldn't know how to manage it. And so on and so forth. So if you have to pay for those services, then I would encourage you, if you can't do it every 3 months, every 6 months, try and do it at least once a year, because that's your health. On the second note, to those of us in the United Kingdom, when you're offered those appointments, please take them up, because it's not because we're trying to tick the numbers. Yes, the numbers are important for us, but it's mainly because of your health. I'm so grateful, Phyllisa. Now, the last question to you, and it's more like an advice. And I would say, what would you tell a younger person, or not even a younger person, because there is an age limit for LADA, but what would you tell somebody living with type 2 diabetes or with LADA? What advice would you give to them?
For anyone who's diagnosed with type 2 diabetes, I would say make sure you don't have type 1 diabetes. Like, get the antibody testing. I didn't know that it was possible to be misdiagnosed for 8 years. And because latent autoimmune diabetes in adults is a slow progression, it could take some people 5 years. 8 years was in my case, and some people have responded on social media and said that it took them 10 years before they became insulin dependent. And so again, I just want to make sure everyone is managing the right thing. That was probably the most confusing for me, why my specialist kept saying no, 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 they wouldn't test me for the antibodies, because I'm thinking, as my doctor, don't you want to know that you're treating the right condition? And lastly, I have a motto, and my motto is diagnose, not defeated. And because diagnose, not defeated is what I have to tell myself, especially when I'm not feeling the best in terms of diabetes, that is where I go to. So I would say, for your spirit, for your body, for your mind, when things get rough, just remind yourself, you have diabetes, but diabetes does not have you. Like Patti LaBelle says, you're diagnosed, not defeated. Like I say, And we are in it for the long run, right? We want to live healthy lives, and it's very possible to live a healthy life with diabetes.
Yeah, that's my tagline. Your health, obviously our passion. I just really, really am grateful to you, Phyllisa, for taking your time out. And we've had to adjust, to our usual time, but I think everyone would obviously say that it was worth it. And people who will watch it later, I've obviously heard things, that I didn't hear when we first spoke or had a video conversation earlier on. I wouldn't steal it. I would borrow your tagline, which is diagnosed, not defeated. And I obviously would tag you onto it because it's not my words. I always say to people, diabetes is a journey, and you get to take people along with the journey, carry your clinicians around, talk about it. And I know a lot of African Americans and Africans or Caribbeans hide that, like either because of the stigma. It's whatever type of diabetes you have. When you're able to speak about it, like Phyllisa did not obviously open up to say she has it, other people would not be able to benefit from it. There is obviously rewards in sharing, people's journey, helping people actually get better. And I think obviously you're doing an amazing job. Can I obviously add on to say, how do people find you if they want to reach out? I know you're not a clinician, but just that support, because support does not know boundaries. It doesn't know whether you're in China or in England or wherever you are. How do people find you? I know where to find you, but how do people find you?
So I am on YouTube. For those of you who are watching on YouTube, you can go over to Black Diabetic Info on YouTube. If you are on Instagram, you can go to Black Diabetic Info on Instagram. And then my blog is Diagnosed Not Defeated. You can read blog posts there. So Facebook, Black Diabetic Info, Instagram, and YouTube all have the same name, but my blog is Diagnosed Not Defeated.
Yeah, once again, Phyllisa, I'm so grateful. I will be on the phone to you afterwards, just saying thank you, leaving your voice note, but I'm so grateful. I'm sure everybody here is really grateful for your time and your knowledge. Even when I spoke to you the first time, you're just so calm. Someone is saying thanks a million for sharing your story. To everyone out there, I'll just keep you on for a second. Thank you so much for joining me in the stories over the last 3 weeks. This is the last. I would like to say, but obviously with respect to the other two, that obviously we saved the last or the best for the last, although the other ones were really good. So thank you so much, Phyllisa. I'm really grateful, and congratulations to your little swimmer. And I'm sure I'm going to look out for her name, like in the pool somewhere in a couple of years. And also thank you to your husband for obviously being supportive to you and your family. And a happy Thanksgiving to you on Thursday. Make sure you enjoy your food, enjoy the cabbage, enjoy whatever you eat. All right. Thank you so much, everyone. It was so lovely having you all here. Thank you so much. Have a good afternoon.